Certified Child Life Specialists are part of the healthcare team. Our role is to help the child cope with hospitalization and what they may be dealing with when they're in the hospital, possibly before the hospital and possibly after. And that could look different for any child. So it really depends on the child's age, their developmental level, their medical history, and their medical package. So when I prepare a child for an upcoming surgery, first I ask a lot of questions, and that could be to the parent or asking the child. And my goal is to really assess what they know, what they think is going to happen, and how they may be coping with it. So I can gather all of that when I talk to a child and family. And my goal is really to provide them with a step-by-step of what they're going to experience, because we know with children it's so important for them to know what to expect. And we find that children have optimal coping when they know what's happening and when there are no surprises. So typically when I'm preparing a child for surgery, I am telling them the step-by-step of what will happen beforehand, while they're here, and also how to prepare for how they'll feel after. So some of the procedures that I support at HSS include non-sedated MRIs, preparation for surgery and support in the holding area before a child goes into surgery, support in the PACU, which can be really important because sometimes kids wake up feeling confused, agitated, irritated, and in pain. I support kids during phlebotomy, so when they're here for a blood draw. I support kids during pin removal because that can be painful and or scary. And I support kids also during their medical appointments. Some kids have medical anxiety, and so they truly have a hard time just sitting in an appointment because they're fearful something will happen, even if it's just to talk or get an examination. I support kids during x-rays, and I also support kids on the inpatient unit, helping them cope with post-op pain, and I use non-pharmacological approaches to support them. So coping strategies is a big topic for child life specialists, and we're always looking to see what the best fit is for a child. So for some kids, it's simply narration and preparing them step by step for what they're going to experience. And simply just narrating a procedure can make a huge difference for a child so they're not sitting in fear. Oftentimes I use validation and sort of gain that rapport and trust before we go into a procedure. So I'll look at them and I'll say, I'm going to tell you everything we're doing. There's no surprises. And so they're like, okay, I think I could do this. I feel that distraction can really help children get through painful and or anxiety-producing experiences in the hospital. In addition, normalizing an experience for them, giving them a role, breathing techniques, guided imagery, aromatherapy, these can all be really helpful to help a child cope with something that's stressful. So I think that parents and caregivers find great value in child life specialist support and having a child life specialist on their child's team. Oftentimes I talk to parents before a surgery or before a non-sedated MRI, and I will tell them what to expect and how they can prepare their child, and they say, thank you so much because I didn't realize that there would be someone to help me understand this so I can best prepare my child. Oftentimes I talk to parents and they say, my child wouldn't have been able to do this without you, get through this without you, and they'll continue to advocate for a child life specialist support throughout their child's medical journey because they see the value in how much better their child copes with hospitalization.